The compound from GRI Bio is really exciting because it's targeting a whole different area for treating pulmonary fibrosis by targeting the immune system. And I think this is a really exciting development in the treatment for pulmonary fibrosis and a great opportunity for patients because it may offer them a chance of having a more targeted therapy that improves their outcome from living with pulmonary fibrosis.
Welcome, everyone, and thank you for joining us today for another Virtual Investor KOL Connect segment. Today, we are featuring GRI Bio. My name is Janine Thomas. I am CEO of JTCIR, and I will be the moderator for today's segment. I am very pleased to be joined by Dr. Al Agro. He is Chief Medical Officer of GRI Bio, and Dr. Helen Parfrey. She is Respiratory Consultant, Royal Papworth Hospital, and Affiliated Assistant Professor at the University of Cambridge. Welcome. So happy to have you with us today.
Thanks, Janine.
Thank you.
Of course. So the focus for today's event will be on IPF and how GRI is working to advance their lead program, GRI 0621, as a potential therapeutic solution that halts disease progression in fibrotic diseases such as IPF. Before we get started, I want to remind our audience that GRI Bio is publicly listed on NASDAQ and trades under the ticker GRI. And during today's discussion, the company will be making forward-looking statements, and I encourage everyone to view the company's website at gribio.com for the latest information. So we are going to dive right in. Dr. Parfrey, can you please provide an overview of IPF and what the current patient journey looks like?
Certainly, Janine, thank you. So IPF, or idiopathic pulmonary fibrosis, is a chronic and progressive lung disease, and it's characterized by scarring or fibrosis of the lungs. And with this condition, the scarring builds up around the air spaces or the alveoli of the lungs. And the function of the alveoli is to exchange the gases that we breathe in and out. And when they become scarred with this disease, they become less effective, so the lungs don't work properly. And ultimately, it makes you feel breathless. But as the scarring builds up over time, it leads to the lungs failing, and people die prematurely because of the lung failure or respiratory failure. Now, it's a disease that we're learning a lot more about. We know it's more common in men and people over the age of 60, and it's associated with a variety of risk factors. So, for instance, it's more common if you've smoked, particularly for people who have worked in various industries, such as construction or building industries, but we also see it in engineers as well. And worldwide, this is growing in its incidence, so it's becoming more common. And we see that not only in countries, sort of developed countries like the UK and America, but also in developing countries. And that's probably because they're undergoing a big period of industrialization at the moment, and there's a lot more pollution, which may all be contributing factors for the development of pulmonary fibrosis. So this is globally is becoming a huge health problem. And when patients present, as I said, it's affecting these parts of the lungs that are involved in how you exchange gases. So they present with breathlessness and cough. And those symptoms are not very specific because they're key to a number of other chronic lung diseases. So these patients often get diagnosed with another lung disease before people realize it's pulmonary fibrosis. So that, for them, there's often a delay in getting their diagnosis of pulmonary fibrosis. And then once they are diagnosed with pulmonary fibrosis, they're normally referred through to a specialist respiratory or pulmonary service where they can have a CT scan of their lung and do some lung function, which actually then helps to work out the type of pulmonary fibrosis they have and whether it's the idiopathic type of pulmonary fibrosis. And because of the various delays along the way, for some people that can take, a year or even 2 years at worst before they can get a diagnosis of pulmonary fibrosis.
Dr. Parfrey, that was extremely helpful. Can you now share the current therapeutic challenges that doctors and clinicians face in treating IPF?
Certainly. I mean, there's many challenges that we face. As I've already highlighted, it's a difficult disease to diagnose. And by time patients often present to their respiratory doctor, they've already got a lot of established pulmonary fibrosis. And that is difficult because at the moment we don't have any way of reversing that disease. So one of the biggest challenges we have is how to diagnose this disease earlier, and that's through raising awareness, but then whether there's other modularities that we can use to get a more accurate diagnosis in these patients. And then once the diagnosis is established, it's working out how best to treat these patients. It's a disease that will progress over time, and the rate it progresses is quite variable. But if you look at large studies, the average life expectancy for somebody with pulmonary fibrosis is about 3 to 5 years. And that's actually worse than many forms of cancer. So we're trying to treat these patients as best as we can. And the treatments that we have at the moment, there are two approved therapies for treating idiopathic pulmonary fibrosis. Neither of them cure the process, but they both slow down the rate that the disease progresses. So they can improve a person's life expectancy. So it may be that their life expectancy is more like 5 to 7 years, but it's a long way from a cure for this disease. And although it helps slow it down, it doesn't actually improve a lot of the symptoms that the patients struggle to manage, particularly their breathlessness and cough. So not only is there a need for better treatments for the pulmonary fibrosis, but we also need to have better ways of treating their symptoms. So it's not only slowing the scarring, but it's also improving their breathlessness and cough. And then ultimately, how we determine what treatment to use for patients is another area that we're not really very well advanced in, because we're not, at the moment, we haven't been able to fully characterize the type of biological processes that are involved in forming fibrosis in the lungs. And there's a lot of work going on in this area to identify new molecules, for instance, and new target therapies to help improve pulmonary fibrosis. And I think when we have a better understanding of the disease process, we'll be able to target therapies according to a patient's individual disease background, if you like, so that we can have better treatments that will help an individual person.
So bringing the focus to GRI, Dr. Agro, can you please speak to the rationale for use of GRI 0621 to treat IPF?
Absolutely. That's a great question, as always, Janine. And I think the answer is best driven by an evidence-based approach. So let's go back to about a decade to the founding of GRI Bio, where the inception of the company was based upon the scientific work of our chief scientific officer, Vipin Kumar. Vipin has spent the majority of his career basically defining and understanding this cell population known as NKT cells. In particular, one of the family members of the NKT cells, known as iNKT cells, seemed to be very important in his hands, as well as many other experts in the field, in the areas of autoimmunity and fibrosis. Now, Vipin was able to show that, in fact, iNKT cells are increased in models of fibrosis, both in the kidney as well as in the liver. And more recently, we were able to show that in models of fibrosis in the lung, particularly the bleomycin-induced model, we were able to show that, yes, in fact, iNKT cells were increased in number and increased in activity. We couple that with some very important human data that was generated from our colleague Adam Byrne in the UK as well as in Ireland, which showed that in patients with IPF, we actually see an increased number and an increase in activity of this same population in the bronchial alveolar lavage fluid of these individuals compared to healthy age-matched controls. So we know that in the disease we're interested in, IPF, there's an increased number of these cells. We know that the cell population is actually in an active state during the disease. And we know that, in fact, in models of the disease, it is very much the same. We came across GRI 0621 several years ago when Vipin came to the conclusion that iNKT cells possess a receptor for retinoic acid. In fact, they have a receptor that both is an isoform of the beta receptor as well as the gamma receptor. So he then charged us with trying to find a modulator of that receptor. And in fact, there is one that was being developed by another company at the same time who looked at it in psoriasis. And in fact, the drug is known as tazorotene. We were able to show in Vipin's hands that tazorotene actually was able to turn off the iNKT cells and stop their ability to produce a number of soluble mediators that actually drove fibrosis. And he showed this again in models of liver fibrosis, in renal fibrosis, and in the bleomycin model, he showed as well that GRI 0621 could turn off the fibrosis associated with bleomycin in a model of IPF in animals. And in fact, it was able to do it to the same degree, and in some instances better than a drug that is actually marketed for the disease, nintedanib, which we were quite pleased to see. So that, in essence, gave us a good foundation of data, which strongly suggested the human experiment needed to be looked at to show that GRI-0621 has the ability to modulate the fibrotic process in patients with IPF. And thus our phase 2 study is built upon that.
Excellent. So you have an interim analysis for this phase 2A study approaching in the near term. What does success look like for this interim analysis?
A great question again. Tazorotene and GRI-0621, if you will, has been looked at in over 1,700 patients already, based on its work with the previous sponsor in patients with psoriasis. So we have a good safety foundation, but we don't know about the safety in this particular population. So this early phase 2 study will first look at the safety and tolerability of GRI-0621. Given that we're trying to show that it modulates NKT cells, and given that we know that NKT cells are responsible for the production directly and indirectly of a number of mediators that actually propagate the fibrotic lesion, we're also taking the opportunity in the interim analysis to have a look at some of these mediators to make sure that they're trending in the right direction. So those are really the two important aspects that we'll get out of this, and will kind of show us whether we're being successful with this treatment during the interim analysis.
Excellent. So we're going to go back to you, Dr. Parfait. If we can fast forward just a little bit, if GRI-0621 is approved, what would this mean for patients and the treatment of IPF?
Well, I think this is a really exciting time actually for treating patients with pulmonary fibrosis. I mean, as we've alluded to, there's already 2 approved therapies for pulmonary fibrosis, but they have significant side effects, and about a third of the patients can't tolerate them. So we really need much better treatments for pulmonary fibrosis that can be tolerated by patients, but not only slow their disease progression, but also may reverse fibrosis and may actually really improve their survival. The compound from GRI Bio is really exciting because it's targeting a whole different area for treating pulmonary fibrosis by targeting the immune system. And I think this is a really exciting development in the treatment for pulmonary fibrosis, and a great opportunity for patients because it may offer them a chance of having a more targeted therapy that improves their outcome from living with pulmonary fibrosis.
Well, certainly an important time for the IPF community and an exciting time for GRI Bio. And with that, this concludes the KOL Connect featuring GRI Bio. I'd like to extend a huge thank you to Drs. Al Agro and Helen Parfait for joining us today. I'd also like to thank our audience for your viewership and participation. As a reminder, GRI Bio trades on NASDAQ under the ticker GRI. And if you like what you saw today, I encourage you to visit gribio.com for more information on the company, to sign up to follow the company to receive their alerts, as well as follow their social channels to stay current on the latest information. Thank you both. Really appreciate having you, and I wish everyone a great rest of your day.